Hi, my name's Ben. This talk is about scaphoid pathways, starting off by explaining why I'm really motivated to explore this topic and do something about it, and I really would be great if we can get more people interested and excited about doing more work in this area. So why am I so interested in this topic? Well, I think the title is probably a bit of a misnomer. It's not really about just scaphoids, it's all about wrist trauma and patients who have normal x-rays and then we don't really know what's going on with them. I remember back in my student days when I was a slightly less motivated individual, some would say maybe a bit of a waster. I remember injuring my wrist playing football. This was a long time ago, starting to feel my age a bit, but I remember coming back and forth to fracture clinic several times, lots of x-rays, never really knowing what was going on, and it took quite a while for my wrist to settle down because I never was given firm advice, because I never had a firm diagnosis, and eventually it did stop grumbling after a few months, but it was never really the most satisfactory of experiences, and that's just from my own personal experience as a patient. I think over my career, having learned more about the evidence, having treated more patients with wrist trauma, it's kind of gradually become more obvious to me from many perspectives, particularly from the patient's perspective, that getting an early diagnosis and getting prompt early treatment is just a no-brainer. It's really important. So for patients who come into the emergency department with wrist trauma, normal x-rays and clinical signs, so some tenderness around the scaphoid, whether that's the tubercle or the snuff box or the dorsal scaphoid, then I think the argument's compelling for early MRI. Why? Well, it's great for the patient. You get an early diagnosis, you get prompt treatment. If you need a cast for a scaphoid fracture that needs cast immobilization, you get it quickly. You get moving if you've got some condition which is safe to mobilize early. It's great for clinicians because you don't have the situation where people come back and forth and you get no clear diagnosis. You're not quite sure what to do. You keep bringing them back for further assessment, further x-rays, and that all links up to the cost effectiveness. NICE recommended early MRI back in about 2016, I think it was, and early MRI is by far the most cost effective pathway because you avoid these repeated clinical attendances and you get an early diagnosis and you don't miss significant problems. You don't miss the undisplaced scaphoid fractures that might not be apparent on CT. You will pick up the patients that need cast immobilization or surgery. So it's really a no-brainer from the perspective of patients, clinicians, and the health service more generally. First and foremost, what I've learned in the year of leadership training has been the importance of genuine listening. I think we all come from different backgrounds, have different perspectives, and if you don't take the time and effort to appreciate where other people are coming from, you're never going to be able to influence people and change systems. So in terms of going about this project, where to go, to start with, the first thing I did was stop, think, and then listen. So where are we now? Well, we haven't really moved much forward in the last 5 years since the NICE guidance came out. Only 14% of centres offer MRI directly from the emergency department. The majority of centres bring patients back for repeat clinical assessment. A high proportion of those centres then repeat x-rays, and then the most common imaging modality after that's been done is then MRI in a delayed fashion. So building and moving forwards, well, it's all about the people. At the moment, I'm trying to build a team of the right people with the right knowledge and experience to move things forward in terms of taking this quality improvement work further. Clearly, a key part of this is stakeholders, the centres that we've involved thus far and hope to involve going forward. I think what really motivates me with this project is that it's not going to be easy. Practice hasn't really changed much in the last 5 years since the NICE guidance was issued, And I think that's why this project is so enticing, because it's going to be tricky. There are lots of barriers that we're aware of, and there may well be barriers that we're not aware of. So clearly the most important thing is looking to develop a quality improvement intervention to go about making the situation better. And the first stage of that is about listening, interviewing, finding out what current experience is, speaking to people and exploring this further. It'd be great if some of you are interested in this, and I'd be very happy for you to get in touch in the future. The more people, the merrier. Many thanks for listening. Please do get in touch with me, and I'm more than happy to listen to any ideas, opinions, whatever you want to say on the topic would be gratefully received. Thanks a lot.